Hello. Hello, everyone. Our topic today is Israel's services, preventive healthcare services for women and children, a service with a very glorious past, as well as some very exciting recent developments. I'm Bruce Rosen for Israel Healthcare Highlights, and my guest today is Dr. Deena Zimmerman, the head of Maternal Child Health Services for the Ministry of Health. Hi, Deena.
Hi, Bruce. Nice to be here.
Good, good. So let's get started. Tell us a bit about your background and your current role.
Okay, so as some people may have already guessed from my accent, I'm originally from the United States, from the East Coast, grew up in New York, and made Aliyah from New Jersey. Did medical school at the Albert Einstein College of Medicine, undergraduate at Yale University, residency at Rutgers University, as well as a master's in public health from Rutgers University. I've been in Israel now for 30 years, actually 29, but going on 30 years, and have worked in many, many different capacities here in the country. Okay, both as a primary care pediatrician in all of Israel's health funds, and starting about a dozen years ago, also at various parts of its public health service. In addition to being a board certified pediatrician, both in the US and in Israel, I'm also a international board certified lactation consultant. So involved with many things that happen to do with breastfeeding. And I've also done a number of things in my religious role, being what's known as a woman's halachic advisor.
Terrific, terrific. Okay, so what can you tell us about Israel's preventive health care for children and particularly about its historical development?
All right. Well, one of the most fascinating things for me about Israel's preventative health care is that it's actually been around longer than the state of Israel. It has a international plot on how it happened, of which I will give the short version. Okay, that in the late 19th century, pediatric mortality, infant mortality was a very big concern all around the world, in countries that today we look at as developed countries, had very high rates of maternal and infant mortality. Part of it having to do with changes brought on by the Industrial Revolution. And one of the first steps that was taken to deal with this was in France, where an ex-army doctor came up with the idea that if I educated mothers how to take care of their babies and make sure that they were getting safe milk to give to their infants, maybe I could do something. And it actually worked, because he built a clinic, which he called in French gourdelet, which means a drop of milk. And this idea spread to England, from England to North America. There was mostly called milk depots. And there was someone in the New York area by the name of Nathan Strauss, who built enough milk depots that it estimated that he saved almost 500,000 children. Now, he happened to have a friend by the name of Henrietta Zolt. Henrietta Zolt showed up in Israel, was appalled by the situation. Now we're up to the early 20th century. And because infant mortality then had improved in places like Europe and North America, but still was quite problematic in the Near East. And she invited Nathan Strauss to come to Israel. And in 1912, he set up a milk depot, okay? And it was given the name of, similar to what it was in France, drop of milk, which in Hebrew comes out as Tipat Halav. So a maternal child system has existed in Israel since, let's see, 1913. It had a little bit of a problem in 1914 when World War I broke out, and the American nurses who were brought to work at this clinic were kicked out of the country. But it then reopened again in 1921, and it has been going since. Originally in the cities of Jerusalem, then Tel Aviv. And when the state was founded, it was taken over by the state.
Okay, that's fascinating. Now we're going to have to, in the interest of time, we're going to have to fast forward. And please tell us how the system, what's the current arrangement?
Okay, so the current arrangement is that standardized care is given to every infant from birth up to 6 years of age. About 50% of the children are getting their services by stations that are run directly by the national government. Another approximately 10% are being given by stations that are run by the cities of Jerusalem and Tel Aviv, who continue to give the service because they were giving it before there was a state. And the rest of them are managed by the health funds. But the key point is that everybody is working according to the same standards and all the children are getting the same services, etc.
Terrific. Now, I understand there have been some really exciting recent developments. Can you share some of them with us?
Well, one of the high-tech things that Israel's public health service has developed is an electronic medical record, which was devised specifically for the purpose of preventative pediatric care. This electronic medical record is used by all the stations run by the government, run by the cities, and run by one of the health funds, covering approximately 70% of all the children in Israel with national distribution. And that gives us a tremendous amount of data. And we were able to, from this, take out 4 million visits where developmental milestones were checked for 1 million children. And based on that, come up with evidence-based, validated developmental milestones, which is the first time this has ever been done in the world. And I don't say that lightly because at around the same time that the article was being published about this, the CDC of the United States also published an article about evidence-based guidelines. About all they were able to do is talk about the evidence behind their guidelines. We were actually able to talk about validation. Okay, we
Okay,
know
now
what
give me an example of how this has been practically useful. I'd like one example at the national level and then another example at the individual level.
Okay, so first of all, at the individual level, when one is talking to parents, one can now say to them, your child is within the norm in a real epidemiological version of the norm. Okay, we know what the fifth percentile, we know what the 95th percentile is, and therefore if a child is outside of the range of norm, we know it for sure, not just because it's a gut feeling. Okay, and second of all, we have found out that the milestones by us are not necessarily what they teach in pediatric textbooks. We've also been able to show and prove that there's a difference between the rate of development of boys and girls, and maybe we should be using 2 different scales. And even the ability to use this data as a kind of predictive tool for early seeing of autism, early diagnosis of autism. That's one of the things we're testing out on it right now.
Now, how does this help you identify and respond to at-risk populations, whether it's in terms of geography or Arabs and Jews or the ultra-Orthodox? Is this helpful at that level as well?
Tremendously, because we have the demographic data on all these children as well. And therefore, there was actually a national report based on this data, divided by where people are in the country and all kinds of divisions and what country the mother was born in and all kinds of demographic data that we have. It was published about 2 years ago, and we're about to publish a follow-up on it. So it's amazing what we can do with this kind of data.
Okay. If you don't mind, given that we're in a conflict situation now, if you could say about something about how this information is being used by you and your others to help specifically Israel's Arab population.
That as soon as one comes up with any kind of gaps, which we're able to identify relatively quickly because it's computerized, then programs are being put into place specifically for the diagnosis. I'll give one example, that breastfeeding rates. Okay, we saw that there is a difference in breastfeeding rates between Arabs and Jews. There's unfortunately the breastfeeding in Arabs is going down, and there's much less exclusive breastfeeding. And therefore, over the course of this year, we're in the middle of doing a mixed method study with the Arab population to try to figure out the why, to then try to make an intervention to close the gap.
Well, that's terrific. That's very important. It's also inspiring that despite the conflicts that Israel has with some of its neighbors, it takes very seriously its commitment and its responsibilities to the Arab minority in Israel. Before we wrap up, I want to thank you, Deena, for this very important information and also for the everyday work that you and your staff do. Before we wrap up, do you have any one or two sentences, thoughts you want to leave with our audience?
I think I just want to reinforce what you were saying about how Israel gives equal treatment to all its citizens. Okay, that's very much the focus of what we try to do in the public health service on a day-to-day basis. It's the same care that's trying to do, and if there's a gap, we're working to close it.
Okay, Dr. Deena Zimmerman, thank you very much.
You're very welcome.